Welcome to Medicare 101, hosted by Bancorp Insurance, located in beautiful Lapine, Oregon. Today we are going to review what Original Medicare is, as well as the supplemental and advantage plans available. After you watch this presentation, you may be interested in discussing your options with our team. Patty, Cherie, Amy, and Jennifer from the Bancorp Medicare team are pleased to be available via phone, video conference, or an in-person meeting. Visit bancorpinsurance.com to request an appointment. Today we will review the various parts of Medicare, including Original Medicare and what it covers, as well as the available options to enhance your Original Medicare plans. Right now, you may be thinking, what is Original Medicare? Original Medicare is a federal health insurance that was established July 30th, 1965, when President Lyndon B. Johnson signed the Medicare law. The program is designed for people 65 or older, certain younger people with disabilities, and people with end-stage renal disease, which is permanent kidney failure that requires dialysis or a transplant. You might also hear this referred to as ESRD. Original Medicare consists of two parts. Part A for hospital, skilled nursing facilities, and hospice care, and Part B for doctor visits, lab work, x-rays and scans, as well as durable medical equipment. Part A is provided at no cost to you if you have worked and paid taxes for 10 years of your life. Part B is optional, but is required for some additional supplemental and advantage plans, which we will discuss further. Plan B does have a monthly associated cost and penalties if you choose not to sign up originally. There are Medicare supplement and advantage plans to provide additional coverage to fill the gaps within original Medicare plans A and B. We will review those later in the presentation. Now, how do you go about signing up for Original Medicare? There are a couple scenarios based around whether or not you are currently collecting Social Security. If you are, you will be automatically enrolled in Part A and B when you turn 65. A Medicare card will be automatically mailed to you. If you are not on Social Security, you will need to contact the Social Security Administration about 60 days prior to your 65th birthday. Let's say you decide to take a grand retirement vacation on or around your 65th birthday. How does this affect your enrollment? If you wait until the month of your birthday or 3 months after, you may experience a gap in your coverage. If you decide to delay enrolling in Part A and or Part B and you have no other health insurance at the time, you can sign up between January 1st and March 31st of each year for coverage beginning July 1st of that year. If you have health insurance at the time from an employer with 20 plus employees, you can delay signing up for Part B without penalty. Just don't forget to contact the Social Security Administration within 8 months of retirement to sign up and avoid any penalties. Let's start by reviewing what is Part A of Original Medicare. Part A is coverage for hospital, skilled nursing care, and hospice for those that have worked and paid Medicare taxes for 10 years or 40 quarters of their life. If you meet that requirement, this coverage is available to you at no cost. If you do not meet that requirement, you will have to pay a premium based on the years and quarters that you have worked. All right, you didn't qualify for the premium-free Part A, and you are debating on whether to enroll now because you don't want to pay a premium for it. You need to be aware that there is a penalty for not buying into Part A when you are first eligible. This could mean an increase of up to 10% in your monthly premium for twice the number of years that you did not sign up once becoming eligible. Note that if you are not signing up due to limited income and resources, you are urged to contact the local or state office to discuss your options for assistance. Let me first explain a benefit period before we get into what you will pay if you have a hospital stay. A benefit period establishes the amount you pay for each Medicare-approved expense based on the benefit period you are currently in. The benefit period begins the day you arrive at the hospital and begin receiving inpatient services. It will end once you have been out of the hospital and have not received any skilled care in any other facility for 60 days in a row. Here's a real-life example. Let's say you go to the hospital in January for a broken wrist, and then you go back to the hospital in April for a broken hip. The two hospital visits would be different benefit periods as they were more than 60 days apart. Let's dig in some more. Your hospital stay is going to cover a semi-private room and board, general nursing and miscellaneous services, as well as supplies. Here is a look at some potential expenses for that stay. For day 1 through 60 in the hospital, you are responsible for paying the Part A deductible. In the 2021 plan year, that deductible was $1,484. After that, through day 60, original Medicare will cover the rest. For days 61 through 90, you will only pay an additional $371 a day. After that, through day 90, original Medicare will cover the rest. For day 91 and thereafter, you're going to be using your 60 lifetime reserve days that original Medicare offers, and you will be responsible for paying $742 a day. After that, original Medicare will cover the rest. Once you have used your 60 lifetime reserve days, you will be responsible for all charges. Original Medicare will no longer cover any charges. Note, all of these numbers on this slide are based on the 2021 plan year and can change annually. Stay tuned later in this presentation for an overview of other plan options to help cover these additional expenses. So remember that broken hip in April? You are now on your way to recovery, and your doctor recommends skilled nursing care to allow you time to get back on your feet. There are a few requirements you must meet to receive the care and coverage. First, you must have a documented qualifying hospital stay of at least 3 inpatient days, and you must have a remaining Part A benefits and days left in that benefit period. If you meet these requirements, your cost for days 1 through 20 in a skilled nursing care will be at no cost to you. If you stay beyond 20 days, days 21 through 100 will have a cost of $185.50 per day, and days 101 and beyond, you are responsible 100% of the charges. Note, these numbers are based on the 2021 plan year and can change annually. Hospice care or end-of-life care is available at no cost to you. However, you may have to make a very limited copayment for prescriptions not covered or coinsurance for inpatient respite care. Let's talk blood. If you are in a hospital or skilled nursing care facility and you receive blood, as you see here, Original Medicare Part A does not cover the first 3 pints that you receive. For Part A, any additional pints over 3 will be covered 100% by Original Medicare, and you will not incur additional charges. Let's move on to Medicare Part B. Medicare Part B is also part of Original Medicare. It is optional coverage, but it is required to enroll in some additional supplemental and advantage plans, which we will discuss in a little bit. It also carries a penalty if you choose not to enroll and enroll at a later date. Part B covers doctor visits, lab work and tests, x-rays and other imaging, and durable medical equipment like oxygen tanks and wheelchairs. Medicare Part B does have a monthly premium that is based on your personal or household income. This premium is deducted monthly from your Social Security benefits. Additionally, Part B has an annual deductible like a traditional health insurance plan. This deductible is separate from your Part B premium. Note, these limits and monthly deductibles can vary from year to year. As I mentioned earlier, if you did not get Part B when first eligible, you will be responsible for paying that penalty as long as you have Part B coverage. That penalty is up to 10% for each 12-month period you could have been covered on Part B. There may be a few exceptions, such as if you are in a special enrollment period. Contact your local office for more assistance. Now, let's go over what you might pay for medical expenses such as physician services, inpatient or outpatient medical, surgical supplies, physical and speech therapy, diagnostic tests, and durable medical equipment. Once you have met the annual deductible of Medicare approved amounts, you generally will be responsible for 20% coinsurance of the remaining Medicare approved amounts. However, Original Medicare does not cover any excess charges. An example of what excess charge is when a doctor does not accept assignment with Original Medicare and can charge up to 15% more than Medicare approved amounts for the services provided. These additional charges are in excess of what Medicare allows, and you would be responsible for those charges. Blood in Part B is similar to Part A coverage, in that the first 3 pints of blood are not covered by Original Medicare, and you will be responsible for 100% of the charges. Beyond that, and after you have met your annual deductible for Part B, you will be responsible for covering generally 20% of the remaining Medicare approved amounts. Both Medicare Part A and B cover home health care, which is care received in your home for services like dressing a wound or injections. The goal is to treat any illness or injury and help you regain your independence. Any medically necessary skilled care or services, medical supplies, are of no charge to you. However, you will have to first pay the annual deductible for Part B if not already met. Once the deductible is met, you will generally pay 20% of the remainder of the Medicare approved amounts for any durable medical equipment needed. This is like a wheelchair or an oxygen tank, for example. It is important to understand what Original Medicare covers and in this case does not cover. As you can see here, Original Medicare does not cover foreign travel, dental, alternative care, long-term and personal care, eyeglasses, or hearing aids. There are additional coverage options available to cover these types of expenses. We will get into them shortly. As we've discussed in the examples of coverage, there are a lot of things that Medicare does and does not cover. Many of the items that they don't cover, partially or in full, are potentially very expensive situations that you might find yourself in. Therefore, you do have options to enhance your original Medicare plan. So let's review why you would do that. Chronic illness, for example, such as cancer, can be very expensive to treat. With Original Medicare, there is no out-of-pocket limit, so a costly procedure or illness can bring limitless expenses that you might not have the resources to cover out of pocket. Let's break down the options to enhance your Original Medicare. Medigap is a Medicare supplement plan that is offered by a private insurance company. It helps fill the gaps of the Original Medicare by helping pay for copayments and coinsurance. However, you are still allowed to see any provider that accepts Original Medicare. There are some things to keep in mind with this plan. You have to continue to pay your Part B premium to keep the plan, and there generally do not offer any extra coverages for vision, dental, long-term care, hearing aids, or glasses. Medicare Advantage plans, also known as Part C, is another way to get your Medicare Part A and Part B coverage. These plans are offered by private insurance companies and most include drug coverage. These plans also cover extra benefits such as vision, dental, hearing aids, and gym benefits. In many cases, you'll need to use healthcare providers who participate in the plan's network and service area to receive the lowest costs. With these plans, you will pay a copay when visiting the doctor, but you are protected by out-of-pocket maximums for the unexpected costs. If you join a Medicare Advantage plan, you still have Medicare, but you'll get most of your Part A and Part B coverage from your Medicare Advantage plan, not Original Medicare. Medicare Advantage plans offer many additional benefits that Original Medicare does not. They can offer financial security for things like vision, hearing, dental, fitness programs, prescription drugs, and out-of-pocket annual maximums for the unexpected. Remember, you have the option to choose to keep your current plan or choose a different plan each year. So, what is the big difference between a Medicare supplement and a Medicare Advantage plan? The answer is risk. A Medicare supplement plan has a higher premium as they are based on age, but they are a lower risk as they fill in the gaps by paying for your copays and coinsurance. Medicare Advantage plans have lower premiums as they do not rate based on age, but they have higher risk because you have to pay copays and coinsurance every time you see a doctor. It is best to sit down with an agent and discuss your situation to help determine what plan is right for you. And remember, you can change it annually. Prescription drug plans are another optional benefit. However, there is a penalty that applies if you decide not to get Medicare drug coverage upon initial enrollment. These penalties can add up quickly and be very costly over time. All Part D plans cover a wide range of prescription drugs that people with Medicare take, including most drugs in certain protected classes, such as drugs to treat cancer or HIV and AIDS. It is important to know what prescriptions you are currently taking so you can discuss what plan might benefit you most with your agent. Let's talk more about the enrollment penalty provide almost all of the same benefits that Part A and Part B do, including hospital, skilled nursing care, hospice, doctor visits, labs, X-rays, and durable medical equipment. However, they offer many additional benefits to provide you with more financial security, including vision, hearing, dental, fitness programs, prescription drugs, and out-of-pocket annual maximums for the unexpected. You would pay an additional Part D penalty for each month without coverage. You have the option to choose in this example, that would be keep the current plan for the rest of your life, plan, or switch back to Original Medicare coverage.
As you can see, this penalty time frame
Medicare Advantage plans provide almost all of the same benefits that Part A and Part B do, including hospital, skilled nursing care, hospice,
open
doctor
enrollment is a
visits,
great time to
labs,
talk to your
x-rays,
agent
and durable
about
medical
Part D
equipment.
if you have not previously
However,
enrolled,
they offer
so that
many
you can
additional
explore your
benefits
options.
to provide you with. Medicare also offers a senior savings model for people taking insulin. Talk to your insurance agent about your prescription needs to ensure you are looking at the right plan options for your needs. With all the various plans, you are probably wondering, when can I apply for these enhancements? The answer is there are some differences between supplement and advantage enrollment periods. So let's go over them. If you are new to Original Medicare, you can sign up for a Medicare supplement within 6 months of being on Original Medicare for guaranteed acceptance. Don't forget that you need to add prescription coverage separately, which can be purchased within 3 months of being on Original Medicare to avoid any penalties. For Medicare Advantage plans, if you are disabled, you will be guaranteed acceptance if you apply within 3 months of being on Original Medicare. If you want to, you can choose a plan with prescription coverage included. If you are eligible for Medicare because you are turning 65, you have 3 months before your 65th birthday, the month of your birthday, and 3 months thereafter to apply. If you have been on Medicare for a while, you can sign up for a Medicare supplement plan any time of the year. However, if you have been on Original Medicare for 6 months or more, you must meet underwriting requirements. For Medicare Advantage, you can sign up during the annual election period, which is October 15th through December 7th of each year. Your coverage will then begin January 1st of the following year. As you can see, Deschutes County has plenty of options for you to choose from. There are 20 Medicare Advantage plans, 12 Medicare Supplement plans, and 29 standalone prescription plans. That is quite a few options for you to be able to select a plan that works for your health needs. Phew, that was definitely a lot of information to take in. Remember, our Medicare agents are here to assist you in selecting the right supplement or advantage plan for your situation. If you would like to request an appointment or more information, please reach out to us with a request to contact you. Our office phone is 1-800-452-6826, or you can see our calendar and request an appointment online at bancorpinsurance.com. We look forward to chatting with you.